Same-day total joint replacement is when a patient safely leaves the hospital to recover at home the same day as surgery. It's grown at the WVU Medicine Center for Joint Replacement, where nearly 60% of knee and hip replacement surgery patients now go home the same day.
The benefits of same-day surgery are really you come in as a well patient. We want you to leave with that expectation of being a well patient and to quicken your recovery. And so the idea is to get you back on your feet and back home where you can recover a little bit easier.
Most same-day patients receive spinal anesthesia, as it can be easier to tolerate and recover from compared to general anesthesia. And patients doing prehab or strengthening exercises before surgery can make a same-day discharge more likely.
We want to get those muscles strong so that when we fix that hip or that knee for you, that we can get you up and take advantage of all that hard work that you've put in beforehand. It's amazing to see how quickly patients that have utilized prehab with their physical therapist or at their local gym do post-operatively as compared to those patients that don't necessarily do those things.
The WVU Medicine Center for Joint Replacement has been doing same-day joint replacement surgery by an expert team for nearly 5 years.
The Center for Joint Replacement is really a beacon of pride for us here in that we have 5 fellowship-trained joint replacement surgeons that are on the cutting edge of technology and their expertise in their fields. But behind them is a team of people, whether it's the nursing staffs, the physician's assistants, the nurses in the clinic that are helping coordinate their care, the care management team, and the physical therapist or anesthesia team, all working together to provide an excellent outcome for you for your hip and knee replacement.
To be eligible for same-day joint replacement, patients must meet some age and health criteria and have a good support system at home. For the WVU Medicine Health Report, I'm Mary Ravazio Menard.